Derrius Carter from CU PhD is generously speaking with us on today's theme, the influence of racism on COVID-19 and other infectious diseases. Thank you to United Way of Champaign County, PNC Bank, Champaign-Urbana Public Health District, CU Mass Transit District, and our other sponsors for sponsoring this event.
Hello, everyone, and welcome to Why We Must Be Anti-Racist. My name is Derrius Carter. I use he, him, his pronouns. I am a two-time University of Illinois alum, so shout out to any U of I alum in the house today, where I got my master's of public health. After graduating, I started working with the Champaign-Urbana Public Health District as a prevention specialist, focusing on HIV prevention, and then as a lead COVID-19 investigator, where I assessed spread, looked at outbreaks, things of that nature. And then during that time, I also became the head of the Coalition for Liberation, which is our CUPHD Equity Council, and I'll talk a little bit about that later. What I'm really excited about is to go on this journey with you all to talk about these topics. Keep in mind, there's so much to discuss in this small presentation, and I won't be able to provide as much nuance as I would like to, but there will be a supplemental Q&A at the end of this presentation, as well as a supplemental reading, just to talk a little bit about how you can further your liberation work or how an organization can further their liberation work. So like I mentioned earlier, I'm so excited to go on this journey with you all, and let's get started. So first, let's talk about racism and COVID-19. I just feel like it's the most tangible example of how racism impacts Black and Indigenous peoples and other people of color. We've been talking about COVID for well over a year at this point, but I think we need to add a little bit more nuance to the topic of how racism intersects with COVID-19. So I'm not going to go into the details of these numbers. I just want you to see who's impacted the most here. But when we look at hospitalization rates by race and ethnicity, we see that Hispanic or Latino, non-Hispanic Black, and non-Hispanic American Indian individuals are the most impacted by this virus. This is not to say that biologically Black and brown folks are more likely to have severe cases of or severe symptoms related to COVID-19. But this is to say that Black and brown folks have a lot of the jobs that we consider essential. And with that being said, these essential jobs require folks to be out in the field and be in close contact with other individuals who may be testing positive for COVID-19. And I want us to ask the questions, why is that, right? Like, I know a lot of folks are like, well, Darius, how's this a race issue? Well, if we see who's being impacted the most, if we see who's being hospitalized the most, and I'm going to talk a little bit about death rates here in a second, if it's Black and brown people, there's a race issue going on, whether it's, who has the luxury to stay home, which historically it has been white Americans, or who has, various access to healthcare in certain circumstances. These are things that we need to start thinking about when it comes to race in America and healthcare. And not even actually thinking, because I believe we have been, unquote, thinking about it, but there needs to be action done. How are we going to make sure that we alleviate or dismantle these disparities in the first place? I love this quote here. It's sad, but it really contextualizes a lot of what I'm talking about. So when if they had died of COVID-19 at the same actual rate as white Americans, about over 20,000 Black individuals, over 10,000 Latino individuals, 700 Indigenous, and 80 Pacific Islander Americans would still be alive. That is a stark contrast. Like, when you look at those numbers and how many folks would still be alive today, it leaves me speechless because of the fact that it shows that there's a structural issue here. And I know that, many people want me to pinpoint exactly what is the one issue, where is that issue, so that we can address it. And it all ties to racism. It really does. And I can go into more details about this in the Q&A. But again, I just wanted to highlight this quote and just talk about, again, that disparity. So let's talk about what's going on in Champaign County. Black Champaign County residents account for 16% of all COVID-19 cases. And this is data taken from this month. That number used to be higher, but it's good that as of right now, it's only 16% of individuals. But keep in mind, uh, Black Champaign County residents account for 14% of Champaign County's population. Okay. And then as of right now, only 6.5% of Black Champaign County residents have been vaccinated. Now, obviously, we have, our tiers about who is qualified first. So we have to take into consideration jobs and roles in the community. But still, we would like for that number obviously to be um, at 100% when the time comes for specifically Black Champaign County residents to be vaccinated. But in some conversations that I've had with folks, many people do not trust the vaccine or government in the first place. So let's have that conversation. So medical racism. You probably have heard of it, but I want to go into a little detail about it. So, it's systemic racism in the medical system. This perpetuates poor health outcomes and leads to distrust for Black people. The medical system was not made for Black folks. You can look at tons of history books and research studies and things of that nature, where historically, healthcare has not been here for us. I mean, when you start even looking at slavery, Black people were used for various surgical experiments, right? So, excuse me. So, we must contextualize this distrust that's within the Black community and how it all ties to racism. We have to talk about limited access to healthcare. That is something else that's very intentional, whether people realize it or not. When we say that Black and Brown folks have limited access to healthcare resources than their white counterparts, that right there shows that there is a race issue. And then when Black and Brown people get into a space where there is a clinical healthcare provider, there is implicit and explicit bias that that healthcare provider has. When I say implicit bias, I mean that underlying bias, that bias that people don't even necessarily realize that they have. And then that explicit bias, where it's something outwardly racist or outwardly harmful that impacts the care of that individual that's in front of them. So we have to talk about medical racism. But I think that there is often this narrative too that just simply says, okay, specifically Black people aren't getting vaccinated. Is it just simply because they don't trust the healthcare system? So I love this quote by Dr. Rhea Boyd. It says, to be clear, decrying Black patient mistrust in the face of the misinformation targeting them is a form of insidious patient blame. It betrays the most basic ethical standards for any medical intervention informed consent. Equal information is a precondition for equal access. Now, what does that mean, right? Dr. Boyd said a lot in the span of a few characters. But I think what she's well, not even what I think, I know what she's saying here is that when we talk about vaccine information and we talk about how information is given out to communities and the types of narratives that are painted on specific communities, right? Those things can be harmful. If you're constantly saying, okay, Black people just simply don't trust the vaccine or Black people aren't going to get vaccinated. Okay, but what is the why? And why is this the only narrative that is specifically put on Black people, right? So I think that again, we need to start unpacking this more. We need to start unpacking the articles that we're reading and just saying, okay, Black people are, because I've seen things like Black folks are anti-vaxxers, right? That is not the case, right? This is not Black people first aren't a monolith. So the way that one individual thinks or operates is not the way that we all operate. So again, these articles that are targeting specific groups of people and blaming specific populations for not getting vaccinated, that's harmful. And again, we need to start having the conversation about how can we make sure that there's equal information that's given out to folks that ensures, okay, everybody understands the importance of vaccine, how this is going to help us get through COVID, and also why this vaccine is safe. let's talk about CUPHD and racism. So I love working for public health here. We've established the Equity Council. It's comprised of myself and three others. We're all looking at internal policy to see how things have perpetuated racism in-house, right? As well as looking externally and looking within the community. What do folks need, and what do folks need to feel safer when they once they enter our doors? We want to do an assessment of systems, kind of like I was talking about earlier, which is looking at that policy, right? We sat down countless times with the directors to talk about, okay, what changes can we make in-house to make sure that this is a better space for our staff as well as for the folks who utilize these services. And then we want to improve access to vaccines. So we've been doing outreach, we've been doing various forms of education, whether that's through technology or in person, like town halls. I've done a few with BNAC, which is the Bruce C. Nesbitt African American Cultural Center on campus, and just having open forums about, why the vaccine is so important and how folks can get vaccinated. Because I think one thing that's confusing too in the midst of all of this is how can I get vaccinated, right? So, and that's something we can talk about in the Q&A. Liberation models and declarations. So, how can we apply these various frameworks to our work and our lives? So I love HIV racial justice now. I recognize that everybody on this call or everybody on viewing this video right now is not working in HIV prevention, but I would encourage everybody to read A Declaration of Liberation, a framework for building a racially uh, just a framework for building a racially justice and strategic HIV movement. I really think that it is a great article. It was released in September of 2017 by HIV Racial Justice Now, which is a steering committee of leaders for advancing racial justice, like I said, in the HIV movement. So please go ahead and take a peek at that, all right? What I love about this is that they define racial justice, which is the collective practice of people of color, allies to identify, dismantle, and heal from the many external and internal harms of structural and institutional racism. And what this basically says is it's going to take all of us, right? It is not the responsibility of Black and Brown folks to undo racism because we didn't create racism. Right. But it is key that Black and Brown folks have a seat at the table when we're talking about policy and we're talking about what is harmful, right? It says allies to identify. Folks just don't come out of the gate being an ally, right? It's important that you do the work in order to be identified as an ally, right? And that's not a title that one can just claim for themselves. That community needs to label that individual as an ally. Again, it says dismantle and heal from the many external and internal harms of structural and institutional racism. And just like I was talking about with medical racism, medical racism has taken so many lives. I was talking to a colleague about maternal and child health, specifically as it pertains to Black women. And when we talk about the type of care Black women receive in clinical spaces, it is absolutely absurd, unjust as to what goes on in those spaces. The amount of pain that is dismissed when Black women say, hey, something's not right, and our primary care provider just completely dismisses it. That's a medical racism issue. So again, I love this definition of defining what racial justice means. And I believe that anybody involved in this work needs to at least take this definition with them as they're talking about engaging in liberation work. So let's talk about why we must be anti-racist. Oh my goodness. So I want everybody to know it is not good enough to just be not racist, right? We can't just simply say, oh, well, I'm not racist, so I'm not part of the issue. There's this quote that says, silence is violence, right? If you aren't being, unquote, mean to somebody, that doesn't mean that you aren't racist or that you aren't perpetuating racist ideologies or engaging and being complicit in a racist system. We must be anti racist. We must constantly be working against racist systems, racist ideologies, and improving what our society is by undoing racism. So, how does one do that? First, we've got to own it. We have to be uncomfortable with any of the isms, right? I know I'm talking primarily from a race based ideology, so I'm talking about racism. But when it comes to any form of oppression, folks of privilege inherently benefit from it. So we need to own that fact. We need to own, white people specifically need to own, okay, I benefit from racism whether I want to or not. White people also need to sit with the discomfort of recognizing how being complicit and being part of a racist system means that they are racist. This doesn't mean that they are bad people. And that's one thing that I want to unpack a little bit here if I can. We can talk a little bit more about it in the Q&A. But I think that what's important here is that when one says, okay, I'm racist or I'm sexist or I'm homophobic, it doesn't mean that you're being a bigot, right? Not intentionally, right? It means that, okay, I'm part of this system that has indoctrinated me with all of these ideologies and I need to undo them, right? I've learned so much over the course of my life and a lot of things that have been harmful. And in order to ensure that I'm constantly and being a better ally to the communities in which I say I love, I need to own this fact of how can I better myself? How can I ensure that I am constantly showing up for those who need me as a person of privilege. So again, own it, right? This is not to say that anybody's a bad person. When I say I'm Darius and I'm sexist, right? I'm not saying this in order to bring myself down. I'm saying this because I recognize that as a cisgender man in a society that glorifies men, right? I recognize that I have a lot of unlearning to do, even now, even with engaging in liberation work that I need to do to make sure that we dismantle sexism. So, again, this is something that we can unpack as well, but we must own it if we are going to be anti racist. Again, we must unlearn it. What do we need to do to actively ensure that I am unlearning racist ideologies, that I am not actively harming Black and Brown folks that I love, right? There are tons of Black and Brown authors who have wrote about racism and wrote about how white people can show up and dismantle, right? Black and Brown people, again, like I mentioned earlier, are not responsible for racism, but we have done a lot of thinking when it comes to how to unlearn it and how to undo these systems. So again, go and I can provide more resources as well. But I always say Google is full and free, right? Google has all of the answers. And as when we're being intentional, we're researching and doing the digging, and we're not just going to the very first link at the top to figure out how to undo racism, right? Because we love to go to Google and just click the first thing we see we then right there we're showing that we're actively doing the work, we're actively trying to unlearn. So yes, that's the second step, and then the last step is addressing it, right? How are we addressing how these systems are impacting us as a society in total, right? I think that another way that we can address racism is talking on a interpersonal level, right? When we're talking with family and we're talking with friends, how are you addressing one's bias or one's racist statement at the dinner table, right? We may not all be in the boardroom or we may not all be in these settings where policy is made, but best believe you are in settings with people who have said very harmful things and you probably either dismissed it or stayed silent or didn't know how to address it. And again, all these things are valid in the process of individuals learning, but now that we know, we need to step up and we need to say, hey, that's not right. We need to challenge people's racist ideology. So that is the final step in which we can be anti-racist. Again, I can talk and unpack a lot more of this in the Q&A later, but those are the three steps. We've got own it. So sit with your discomfort, own the fact that you are problematic, right? And that's not a bad thing, but we need to own that. We need to own the hurt that we've caused, or implicitly or explicitly. We need to unlearn it, right? We need to do the work. We need to find the resources. We need to think about ways in which we can mobilize change. And lastly, we need to address it. again, with family members or on that policy level, if we have that type of institutional power. Lastly, I want to talk about equality, equity, and liberation. I know I've been throwing that word around a lot. Liberation can be daunting, but I really feel like we need to move towards a framework that centers liberation. I love this graphic here. As you can see, there are three individuals trying to see a baseball game. When we talk about equality, we're talking about giving everybody the same resources. But the fact of the matter is, not everybody needs the same resources. If you look here, there's one individual who's much taller than another. So that individual still cannot see beyond the fence to see the game, even though they're all given the same size box. Now, when we talk about equity, we're talking about ensuring that folks who need said services or need said resources are given those platforms so they can see over the fence. But what I think that we don't recognize with equity is that the issue is not the box. The issue is simply the fence. And we eradicated the fence being that system of oppression, we can get past the need for the boxes and ensure that everybody is welcome to the table and everybody can see the game. So that's why I enforce liberation so much, because I'm talking about undoing racism, undoing transphobia, undoing sexism, undoing all of these systems that have aided and led to the deaths of so many people. So again, when we talk about doing anti-racist work, we must do so from a lens that centers liberation. I love this quote from Angela Davis that says, in a racist society, it is not enough to be non-racist, we must be anti-racist. So we can't just be, oh, I'm a good person on the surface and I engage in all of this good work. That's great. But how are you ensuring that you are anti-racist, right? How are you ensuring that the work goes beyond just one good deed, that the work is continuous, and that you are constantly unlearning in order to be a vessel for change? So thank you all for this time. Again, I wish I could go into more detail, more nuance, especially when I'm talking about racism and COVID-19. But if you would like to continue this conversation on any other platforms, I'm available on all social media at Darius MPH, as well as via email, dcarter at c-uphd.org if you would like to email me. But again, thank you all for your time. Thank you for allowing me into your homes. Thank you to the YWCA.